Good day everyone, I'm Alexander James Y. Palad from DSN22. So for today, I'm going to show you the proper procedure of the home visit performing the bag technique. Okay, so for the assessment, we need to gather all the equipments that we're going to use in this procedure. We need to identify also the patient, then get all the necessary data, then observe the patient and determine the health needs, and also provide privacy always whatever nursing interventions we're going to render. Okay, so for the planning, you need to formulate your nursing objective for the home visit. So in planning also, you need to consider and give priority to their essential and recognized needs of the individual or and his family. So planning also in the delivery of care should be involved of the individual and the family also. So planning should be flexible. So here is my sage and bag. So upon arriving at our patient's home, first we need to find a suitable place or a flat surface wherein we're going to align it with a plastic lining and a paper lining so that our bag won't be contaminated. So I have here a plastic lining. So we're going to place here. And also I have a paper lining here. Okay, so after putting the plastic lining and the paper lining, we're going to place our bag on the blind table. Okay, so after placing our bag, we're going to ask the patient if they have sink for us to wash our hands. And if they don't, we can ask the patient for a basin with a clean water. Okay, so now we're going to open up our bag, then take out the soap and the towel to wipe our hands. And it is to prepare us for hand washing. So here is our towel and here is our soap. Okay, so after washing our hands, we're going to open up our bag again. We're going to take out the apron. So I'm going to open up the bag again. Then we will get the apron. So right side must be out. So the purpose of the apron is to protect us nurses, our uniform, from any bodily fluids that we may be encounter all throughout the procedure. So I'm going to wear the uniform. So I'm going to wear it. Then I'm going to tie it. Okay, so after putting our apron, we're going to take out all the equipments that we're going to use in this procedure. So now we will be doing the fundic height measurement. So we will be using tape measure and we will be doing also the perineal cleaning. So we will be using also a cotton balls, irrigating solution, and so on. So we will take out now all the equipment. So we have cotton balls here, tape measure and irrigating solution in a kidney basin. Then close the bag and place our bag in a one working area. So make sure that it is located on the plastic lining and the paper lining so it won't be contaminated and to prevent cross-contamination. So when the procedure is already done, we're going to disinfect or clean all the articles that we have been used. So by wiping and sanitizing the articles, it can prevent to the cross-contamination. So we're going to wipe. So after disinfecting all the articles, we're going to perform hand washing again to prevent any mode of transmission of infection. So after we perform hand washing, we're now going to remove our apron. So now we're going to remove our apron. So we don't need to touch the contaminated part of the apron. So we need to hold it on the inner side to avoid contamination or cross-contamination. So the purpose of apron for us nurses is to protect our uniform from any bodily fluids that we may encounter all throughout the procedure. So we're going to place it on our bag. So after performing the hand washing, removing the apron, and replacing all the articles that we have been used on our CHN bag, we're going to remove now the paper and the plastic lining on the table. So I'm going to get the CHN bag. Then we don't need to touch the contaminated part of the paper and the plastic, so that to prevent cross-contamination. So we're going to place it in our CHN bag. Then we're going to remove the plastic. So here. Okay, so we have now kept everything on our CHN bag, the linings and the equipment. So now we're going to discard all the equipments that we have been used. So as you can see, I already discard all the equipments that we have been used, and I place it on a proper receptacle. So as you can see, our working area is clean now. Okay, so we need to document the findings and the procedure of care that we have been done in our notes. So we've asked the patient when we can do it, the second visit. So we've agreed upon that we will do it next week again. So now, I'm going to show you the contents of my CHN bag. So starts from the medicine. So I have here a 70% alcohol, hydrogen peroxide, a betadine solution. So for the sterile items, I have disposable syringes here, 1cc, 3cc, and also 5cc. I have also here hypodermic needles, 19 gauge, 22 gauge, and also 23 gauge, and I have also here 25 gauge. So for the sterile dressing, I have here cotton balls in a small container just to fit my bag, sterile gloves. I have also here a gauze pad 4x4, 4 pieces, and also a 5 pieces sterile tongue depressors. So for the equipment, I have here surgical scissors and a forceps, one curved and one straight. So I have also here a pen light, thermometer, tourniquet, tape measure. I have also here soap dish and a soap. I have also here a straight catheter, and the most important, stethoscope, apron. I have also here ice bag, hot bag, and disposable mask. And the most important is the CHN bag. Okay, so for the evaluation, you need to record all the relevant findings identified to your client, and include quality nurse and patient relationship, and also document all the nursing care rendered and the effectiveness of nursing care provided. Refer to the RHU or Rural Health Unit if there's any abbreviation from normal findings. That's all. Thank you for watching.